I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Urology and Multispeciality Hospital, Bengaluru. Hello. Many people come to me with a complaint of inability to evacuate urine. They come and say, Doctor, I pass urine, but it takes a very long time to empty the bladder. Or even if I pass urine, I feel something remains inside at the end of urination and I have to go again to the toilet in the next few minutes to pass urine. And when I pass the urine the next time, I get scanty urine, that is about 10 cc, 20 cc or even 50 cc. And sometimes I get only a few drops of urine, but still I am not satisfied because I feel something remains inside. So this problem is a problem of inability or difficulty in emptying the bladder. Now, why does it happen? This happens because of many reasons. The problem could be at the level of the urinary bladder, or the problem could be at the level of the urethra. Urethra is a tube which conducts urine from the urinary bladder to the outside. So either the reservoir or the bladder is at a problem, or the conduit, that is the urethra, is in a problem. When a patient comes with this problem, we take a detailed history and do some physical examination to see if there are some abnormalities in the penis, like for example narrowing of the opening of the penis. We also carry out some tests to see if the person has urinary tract infections, bladder abnormalities, kidney abnormalities, etc. Once these tests are done, if we are in doubt, we do a test called urine flow rate or UFR, in which we ask the patient to pass urine in a machine with a sensor, and that detects the force or the speed of urine which falls outside. With the help of these tests, we will more or less come to know what is the problem. What are the common problems why the person is unable to empty the bladder? As I said, the problem could be in the bladder. And what are the common problems in the bladder that causes problem? Maybe the bladder is weak. This weakness could be because of some neurological reasons, or it could be because of the weakness of the muscle of the bladder itself. These can happen because of various reasons which have to be evaluated by the urologist and treated. The second cause why a person is unable to empty the bladder completely is because of the problem in the passage. And as I already referred to the passage, it is called the urethra, and this consists of various segments. The passage can have a segment called the bladder neck, it can have prostate, or the conduit itself, the urethra. So problem at any of these levels can give rise to this problem. For example, the bladder neck can be narrow. This can happen because of congenital problems or acquired problems. The prostate could be enlarged, which causes blockage to the passage of urine, and prostate enlargement, as you all know, occurs after the age of 55 to 60 years. And if an elderly person comes to me with this problem, the first thing that I think of, or any urologist thinks of, is enlargement of the prostate. There also could be a problem in the urethra, that is because of the narrowing of the urethra, and this condition is called stricture of the urethra. Or if the problem is at the opening of the urethra, that is called meatal stenosis. The urethral problems commonly occur in the youngsters, whereas as I already said, the bladder neck and the prostate problems occur in the elderly age group. The treatment depends on where the problem is. If the problem is in the bladder, there are some medications to improve the tone of the muscle of the bladder so that it contracts better and expels the urine better. However, if the problem is at the level of the prostate or the bladder neck, there are drugs which decrease the size of the prostate and relax the bladder neck so that the flow improves and the person can empty the bladder more easily. However, if there is a narrowing in the urethra called stricture urethra, then it is a mechanical problem, in which case tablets do not work. The only treatment is some endoscopic surgery to increase the width of the passage so that the person can pass urine easily without leaving any residue inside. So broadly speaking, these are the causes and the treatments for difficulty in emptying the bladder. I hope it was useful, and if there is any problem, you can go to the urologist and this can be easily sorted out. Thank you.